Wisdom teeth are third molars that erupt between the age of 17 to 25 years. Though all wisdom teeth are not problematic, some may become impacted due to loss of space, smaller jaws, and many other reasons. This brings into the need for extraction of wisdom teeth. Done under a local or general anesthetic, wisdom tooth extraction is a minor surgical procedure that, in most cases, leaves a swelling post-operatively. Undergoing a wisdom tooth extraction necessitates stringent adherence to specific post-operative care to mitigate swelling and promote quick recovery. The timeline for healing of an extracted wound varies, but typically, you can expect the initial stages to occur within the first week. Healing continues over the next few weeks to months as the gum tissue and bone gradually recover. For the first couple of days, some minor bleeding and oozing are common. Remember to change the gauze as directed by your dentist. Pain and swelling usually peak during this period, so it's important to use the prescribed painkillers and apply ice packs to help reduce the swelling. Blood clots will form in the extraction site, and these are crucial for healing. To avoid dislodging them, refrain from rinsing vigorously, spitting, or using straws. From day 3 to 7, you should notice a reduction in swelling and pain. It's normal to see some bruising around the extraction site. If non-dissolvable stitches were used, they may be removed around day 7. Week 2, healing continues. Pain should be minimal, and normal activities can usually be resumed. Stick to soft foods, but chewing should be easier now. Week 3 to 4, the extraction site continues to heal and the socket starts closing. Mild discomfort may still be present, but most healing has occurred. By months 2 to 3, the extraction site should be fully healed. The bone and gum tissue will be well on their way to complete recovery. Early care after wisdom tooth extraction is crucial. Within the initial 24-hour period, patients are advised to apply an ice pack to the affected area for 15 to 20 minutes every hour. This crucial step assists in constricting blood vessels, thereby significantly reducing swelling and discomfort. Commencing this procedure as promptly as possible after surgery is vital for optimal results. Additionally, maintaining an elevated head position is critical in these early stages. Utilizing a pillow to keep the head raised while resting or sleeping helps to diminish blood flow to the surgical site, thus minimizing swelling. This can be particularly effective during the first night following the procedure. Hydration plays a pivotal role in the healing process. Consuming ample fluids, particularly water, is essential to keeping the body's systems functioning efficiently and supporting overall recovery. It's important, however, to avoid the use of straws as the suction motion can disrupt the blood clot formation and increase the risk of complications such as dry socket. Furthermore, patients should refrain from engaging in strenuous activities during the first 24 hours. Any activity that could potentially elevate blood pressure and thereby exacerbate swelling should be avoided. Rest is a key component in the body's healing process. Adhering to prescribed medications is another fundamental aspect of post-operative care. Anti-inflammatory drugs and antibiotics, if prescribed, must be taken according to the dentist's recommendations to effectively manage pain and prevent infection. Following the dosage instructions precisely ensures an optimal environment for healing. The initial care that you take during the first day after wisdom tooth extraction helps in faster healing and prevents further complications. As you transition past the initial 24 hours following your wisdom tooth extraction, ongoing care and lifestyle adjustments become essential to ensure optimal recovery. One of the key practices is the use of warm saltwater rinses. Starting on the second day post-extraction, rinsing your mouth gently with a warm saltwater solution can help reduce bacteria and promote healing. Be cautious to swish the solution gently to avoid disturbing the extraction site. Maintaining oral hygiene during this period is critical but should be done with care. Brush your teeth gently, avoiding the direct area of the extraction. Consider using a soft bristled toothbrush, and be mindful not to disrupt the blood clot that forms over the wound, as this clot is essential for proper healing. Avoid using any commercial mouth rinses that contain alcohol, as they can impede the healing process. Dietary adjustments are equally important. Stick to soft foods that require minimal chewing to reduce irritation to the extraction site. Nutrient-rich options like yogurt, applesauce, broths, and smoothies are excellent choices. It's vital to avoid hard, crunchy, or spicy foods that could dislodge the clot or cause discomfort. To prevent introducing bacteria to the wound, refrain from smoking and using straws. The suction from these activities can dislodge the blood clot and lead to complications such as dry socket. Continue to follow any medication regimen prescribed by your dentist, including antibiotics and pain relievers. Consistent use as directed is crucial to managing discomfort and preventing infections. After a wisdom tooth extraction, it is imperative to be vigilant about potential post-operative complications. While some level of discomfort and swelling is to be expected, certain symptoms may indicate more serious issues that require professional intervention. Recognizing and promptly addressing these complications can significantly impact the healing process and overall recovery. Key signs to monitor include prolonged swelling, increasing pain, fever, and unusual discharge such as pus from the extraction site. These symptoms might signal an infection, a common complication that necessitates immediate attention. Additionally, if severe pain persists 3 to 5 days post-extraction, it could indicate dry socket, a condition where the blood clot at the extraction site is dislodged or dissolves prematurely, exposing the underlying bone and nerves. In the occurrence of any of these symptoms, contacting your dentist without delay is crucial. Timely intervention can prevent further complications and aid in a smoother recovery. Regular follow-up appointments are equally important for monitoring the recovery progress. These visits allow the dentist to identify any emerging issues early and adjust the treatment plan accordingly. For more useful dental tips, log on to smile-wide.co.in.